Mrs. Smith suffers from dementia. Her husband recently passed away. After several car accidents, she lost her driver's license and can't get to her doctor's appointments. And without her husband's help, she has fallen behind on bill payment. Her physician, Dr. Jones, becomes concerned when she calls him frequently, always asking the same questions. It's common for individuals with dementia to have trouble planning and carrying out tasks. The doctor worries that the dementia, aggravated by the trauma of her husband's loss, may affect Mrs. Smith's ability to care for herself. He refers her to the medical team's Journey Behavioral Home Health Program so she can get the help she needs. Jennifer is a medical team behavioral health nurse who will handle Mrs. Smith's case and help improve the quality of her life through a positive therapeutic relationship. Jennifer first conducts a comprehensive assessment while working to build Mrs. Smith's trust. She tests Mrs. Smith's memory and problem-solving skills, administers the geriatric mood scale, and checks her vital signs. After the assessment, Jennifer works with Mrs. Smith to develop an individualized plan of care. She calls Dr. Jones to inform him of her findings, and he approves the plan of treatment. Jennifer then begins treating Mrs. Smith according to her plan of care. She starts with a medication review and helps Mrs. Smith organize her medications. Jennifer visits regularly to ensure Mrs. Smith is taking her medications correctly. Once Mrs. Smith's medication routine has been established, Jennifer can focus on methods to decrease her anxiety and start the grieving process. She uses therapeutic counseling techniques and teaches Mrs. Smith coping skills to reduce her anxiety using tools from the Journey program's Grief, Loss, and Recovery Care Kit. Dana is a medical team social worker whose role is to help Mrs. Smith access community resources and ensure that her home environment is safe. Mrs. Smith is at risk of falling, so Dana sets up a medical alert system. Also, Dana guides her through the process of securing a legal guardian to help with finances, since Mrs. Smith doesn't have any family. A common symptom of dementia is inattention to personal care. As Mrs. Smith's treatment progresses, she accepts and aids help with grooming and bathing. Lisa, a medical team home health aide, helps Mrs. Smith learn to take better care of herself, which also helps improve her self-esteem. With ongoing help from the Journey program, Mrs. Smith received the support and services to help her through the trauma of losing her husband and to regain control of her life. If your patient or loved one could benefit from the Journey Behavioral Home Health Program, please contact us to learn more.